Hello, everybody, and welcome to the Look Good, Feel Better speaker series featuring Dr. Linda Carlson. My name's Sue Larkin. I am head of programming for Look Good, Feel Better, and we're just going to give it a minute to let everybody join in and give everyone a second to grab their tea, their water, whatever it is that they're going to do, and we will get started in just a moment. Olivier, pour les personnes qui parlent en français, est-ce que tu peux dire les instructions pour cette personne?
Yes, Sue. So hello, everyone. So I'll just give the instructions for interpretation. First in French and then in English. Alors, bonjour tout le monde. Pour l'interprétation, un bouton va s'afficher au bas de votre écran. Alors, je lance l'interprétation en ce moment. On va avoir l'interprétation qui est disponible au bas de votre écran pour un ordinateur portable ou pour un ordinateur. Si vous êtes sur iPhone ou tablette, en haut à droite, les trois petits boutons interprétation et simplement choisir votre langue. Ensuite, maintenant pour l'anglais, now in English. So I just started language interpretation. So it should be at the bottom of your screen. Simply click on interpretation and your language of your choice. So if you are on a iPhone or a tablet, click on the three little dots and select your language under interpretation. Thank you.
Merci, Olivier. Thank you. Thank you, everybody, for joining. I see we still have a couple more people coming in, but we will get started with the introductions. I want to make sure we have as much time as possible with Dr. Carlson. So as I mentioned, for those of you just joining, I'm Sue Larkin, head of programs for Look Good, Feel Better. And just a reminder, everything that we talk about this evening is really meant for your general information. If you've got specific questions about your treatment or what you're going through, please do make sure you talk to your own medical team. And I want to say again, thank you for joining. We actually have representatives, people have signed in from every province across the country, a couple folks down in the US as well. So thank you so much for joining. Just a couple of features, you'll see a chat box and a Q&A. The chat box, you can put questions in there. So throughout the evening, if you've got questions for Dr. Carlson, please feel free to put them in there. And a thank you to everybody who posed their questions when you registered. And I've got that list, and we're going to do our best to get through as many of those questions as we can this evening. And of course, I want to thank the Globe and Mail for sponsoring and helping to make this evening possible. So I am pleased to introduce Dr. Linda Carlson, our speaker for this afternoon or this evening, depending on where you are across the country. And of course, Dr. Carlson's bio is on our website. I think I would take the whole hour, Dr. Carlson, if I read the whole thing. But just to flag a few highlights, Dr. Carlson holds the Enbridge Research Chair in Psychosocial Oncology. She is a professor in psychosocial oncology at the Department of Oncology at the University of Calgary, Director of Research, as well as clinical psychologist at the Tom Baker Cancer Center, again in Calgary. And of course, numerous publications and articles, TED Talks, and a wonderful book called Mindfulness-Based Cancer Recovery. And later we'll be putting resources and including that book title in the chat. And again, we'll send that out at the end as an email. So all that information is coming. And Dr. Carlson has given us permission to call her Linda. So Linda, thank you so much and welcome.
Well, thank you for the kind introduction, and I'm really happy to be here to speak to your group.
Wonderful. So I think the first question is, you see it all over the place, no matter mindfulness, it almost feels like it's like a trendy thing, but it's been around for a long time. So let everyone know, what is mindfulness? How do you define it?
Sure. So, mindfulness is a pretty simple concept. It's not the easiest thing to master, but it's simple in its definition. So we would just describe mindfulness as paying attention on purpose in the present moment with a certain attitude that's non-judgmental and accepting. And so you can think about breaking down that definition into different parts. And so we think about it as three components: intention. So why would we practice mindfulness? Attention training. So what do you actually do when you practice mindfulness? And then attitudes. So how do we practice mindfulness? That's the sort of how piece. And I'll talk about those three in a second, but I want to focus on the core feature of the definition, which is in the present moment, paying attention on purpose in the present moment. And so you might ask yourself, well, if my mind's not in the present moment, well, then where is it? What else could I be doing with my attention? And so there's some really interesting studies that have looked at what our minds are doing and how we feel during the day. And it turns out that we have anywhere between 50 and 70,000 individual thoughts every day. So that's a lot of thoughts, right? And so what's the content of the thoughts and how does that relate to our moods? And so when they give people pagers, or they ping them on their cell phones throughout the day and say, what are you thinking about and how are you feeling? It turns out that, and I often ask audiences, what proportion of the time do you think our thoughts are in the present moment? And people usually guess quite a low number. But in this study, it's about half the time our thoughts are not in the present moment. And so the other half the time we are actually thinking about what we're doing. And it turns out that when we're thinking about what we're doing and paying attention to that, we report feeling happier. So being in the present moment, no matter what you're doing, if you're paying attention to it, people feel better. And you might ask yourself, well, why would that be? And so it's useful to think about, if you're not paying attention in the present moment, where are your thoughts? And there's sort of two places they tend to go. And so one is in the past, right? So we might be thinking, oh, why did I say that? Or if only I'd done something different, or why me? How did I get in this situation? Or going over a conversation you had, oh, shoulda, coulda, woulda done or said something different. So you're ruminating about this over and over. You can't change the past. So you have these regrets and you might feel angry about something you or someone else did or said. And so you're sort of reliving all those, and those thoughts lead to feelings of depression and sort of sadness and frustration and regret, right? Or you might be racing off into the future. And that happens to a lot of us as well. So we're worrying about all the things we have to do and all the things that might happen and the unknown and the uncontrollable, horrible things out there in the world. And so we get very stressed and very anxious, right? So the past has already happened. We can't change it. The future is kind of a projection, a fantasy of all the possible things that might go wrong. But the only time we have to live our lives is here in the present moment. And this research shows us that when we train ourselves in the capacity to do that, we live happier lives no matter what we're doing or what's going on around us. So that's this idea of mindfulness, is learning to be in the present moment. And I know I'm going on, but let me just finish one piece of this. So mindfulness is also kind of two things. It's a way of being in the world, right? So we can be more or less mindful at any given time, no matter what we're doing. But it's also a practice. So it's also a skill that we learn to develop, is the capacity to keep our attention in the present moment. And so that takes us back to the IAA model, the intention, or why we practice mindfulness, the attention training, so the actual formal practice of sitting down and paying attention and bringing our mind back to the present moment. And then the third piece, the attitudes, how we need to do it, which has to be in kind of a kind, compassionate, non-judgmental way. Otherwise, we just beat ourselves up because it's not an easy thing to learn right away. So I'll stop there for a pause.
That's great. Thank you. You also talked earlier when we were chatting, we talked about how mindfulness manages stress. And that's one of the benefits. Can you talk a bit about, and just for everyone, we're going to get to some mindfulness practices, so don't think we're just going to talk the whole time, but we're going to talk a little bit first. So in terms of managing stress, why is that important? And why is that important, especially for people facing cancer?
Oh, well, sure. I mean, we all experience stress, right? And so there's sort of two sides to it. There's the cognitive, or the way we think about what causes us stress, and there's what it does to our body. So the physiological reaction, that fight or flight response we have, and the features of experience that humans find stressful is when things are uncontrollable, when things are unpredictable, and when things have important ramifications or consequences, right? So, I mean, a cancer diagnosis, a cancer experience checks all those boxes, right? It really may be the first time that you've been challenged. Most of us have a belief that we control the way things, unfold around us in the world. And that's an erroneous belief, but it's not often challenged as directly as when you find out you have a cancer diagnosis or you have to go through cancer treatment. It's like, wow, I had all planned out in my mind how life was going to go, with work and retirement and family and all those sorts of things. And then this diagnosis comes out of the blue, and all of a sudden you realize, wow, I didn't really have as much control over how my life was going to unfold as maybe I thought I did. So that can really challenge a lot of assumptions we have about the world, losing that sense of feeling you have control, you know, and then the unpredictability of how this is all going to unfold, what kind of treatments you're going to need. You know, no one can tell you for certain what the prognosis is. And, you know, even if you have a really successful treatment, there's always that fear of, well, what if it comes back? You know, how will I deal with that? How will I know? And so there's this hypervigilance of every ache and pain, you know, you're like, is that the cancer coming back? What does this mean? And so there's a lot of anxiety around that as well. So I don't know if that directly answers your question.
Yeah, no, it does. Thank you. And the mindfulness, I guess, you know, thinking about those stressors, that mindfulness and being in the present kind of stops us from thinking about the past and worrying about the future, and being mindful in that moment. And that helps manage the stress.
Yeah, that's definitely part of it. And also the way that we create our own stress, right? Because the same thing can happen to two different people. The exact same thing in the world, you know, I mean, use a general example right now with dealing with the COVID crisis and, you know, all the restrictions. And, you know, some people will not be fazed by it at all, and other people will be really upset. And largely that's around how we interpret or perceive what's happening in our world, right? So there's many different ways we can sort of think about the importance and the ramifications. You know, and characteristically, we tend to do things like, for example, catastrophizing about something, or taking things personally when perhaps they're not, you know, jumping to conclusions when we don't have enough evidence. And so these ways of thinking can also create stress or cause more suffering to us when, you know, there's many different ways to interpret the situation, perhaps.
Great. Thank you. I wouldn't mind trying an exercise. Can we do that?
Sure, we can. Sure, we can.
So follow along. No one else has their cameras on, so no one can see you if you're, you know, out there. Please join us in. How do you like to introduce mindfulness? What's one of your favorite exercises to start with?
Well, you know, just a simple awareness of breath is really good, right? Because we're always breathing. Our breath is with us all the time, but, you know, we're not often paying attention to it. So really the first piece around mindfulness is just noticing where our attention wants to go. And so we will try to direct it on the breath, but you'll notice as you're doing that it's jumping around. And so there's sort of two pieces to this. One is just paying attention to the breath in the body and noticing what you can. The other piece is also noticing, you know, what your mind wants to do instead. So it's just a simple breathing exercise to put one hand just sort of here on your chest and one hand lower down on your belly. Oh, and you know, I didn't talk enough about the attitudes, about the approach, but one of them is non-judgment. And so we're often very judgmental about the size of our belly and how squishy it might be. So if you feel it bulging a little bit, just let go of that judgmentalness. Okay, so we're gonna do an exercise here without changing the breath. So I don't want you to try and change the way you're breathing. Just pay attention to how the breath is coming and going in your body. And having your hands here on these two parts of your body just allows you to really feel the movement with the breath. So as you breathe in, just notice, again, it's like you're a breath detective. So you can allow your eyes to close if you want. And also you might want to sit up a little bit so that you can feel the breath moving in your body and it can sort of flow in and out without being obstructed. So if you're slumped over, it's harder to breathe. So sort of sitting up straight. And again, don't try and change your breath. Just notice what's happening here. So as you breathe in, you'll notice movement, and just noting if you feel that movement in the top hand or the bottom hand, and how long is that breath? And then as you breathe out, the same thing. Where is there movement and how much? Is the in-breath a similar length to the out-breath? Is one shorter than the other? What happens as you switch from in to out? Is there a pause? Does it flow? And there's none that's better or worse than the other. It's just awareness. So you might find yourself saying, oh, I'm not breathing the right way, or thinking, you know, you should feel movement here or there. Just noticing what's actually happening. So maybe you also become aware of tension in the body. So maybe the shoulders or the jaw. Maybe you're holding in your belly. So as you exhale, just imagine that tension releasing, allowing the breath to flow. And at some point, your mind will probably wander. And it may go to your plans for dinner or what you have to do tomorrow, or some worry you have, or some conversation, wherever it goes. As soon as you notice it, just lead it back. Almost like you're training a puppy. You just kindly, gently lead the attention back to the breath. So feeling the in-breath, noting its length, feeling the out-breath, and approaching it with a sense of curiosity and openness. So what else can you notice? About your breath, about your body, about your mind. And so one other thing to check in on is what happens to your breath as you're paying attention here. Does it change in any way? So let's just take a couple more breaths. And then just lowering your hands, opening your eyes if they were closed, just return to the Zoom, as I say these days.
That was wonderful. I think you were in my mind, because just as you were saying, don't be judgmental. Hang on a second. And I see a couple questions. Deepu, thank you for your question. I'm going to make sure we get to that in just a second. And we'll keep an eye on some of the other ones as well. That's okay.
I got like 2 of them on.
No worries. So I swear you were in my mind when you said don't be judgmental about your belly. I was thinking about, the peanut butter cookies I ate last night. And then when you said, dinner, I thought, oh, did my husband remember to put the thing in while I'm doing this? And like everything. And you must get people in your practice, in your clinics. You must, like, I've done this before and I've gotten angry because I'm not any good at it and I can't focus. So what do you say?
Let's get to that in a second.
Awful at this.
Let's get to that in a second. First, I want to just have people reflect on the experience a little bit there.
Perfect.
So just think about what did you notice, and people can put that in the chat. Sorry, I'm a little distracted. It keeps popping up for me every time someone puts something in, but that's something to share. So did you feel movement in the top hand, in the bottom hand? Did you notice any changes as you were paying attention? What was the overall experience like? So was it frustrating? Was your mind running around? Did it feel calming or relaxing? So there's many different sorts of experiences people can have here. And really, like I said, there's no right or wrong way, but it's just a reflection on when we pay attention in the present moment to the mind and the body, what can we learn about ourselves and perhaps how we cause ourselves stress? How we perpetuate suffering sometimes just by the way we're hard on ourselves, or like you said, so it comes back to your thing, I'm doing it wrong. I'm no good at this. I'll never learn.
And what do you, that for those of us that our mind was wandering, we kept, what do you say to the folks in your clinic when they come back and say, this isn't working? I've tried it. I just get frustrated or distracted or whatever it is.
Yeah, for sure. I'm looking at the chat. Some people say relaxing, some people say they're agitated, so there's a lot of different experiences. So when people say they had a hard time, I say that's totally normal. That's totally normal. And most people struggle with this because we have been trained our entire lives to be unmindful, really. You know, when you're born, you're mindful. Like, you look at a child, a baby, they're in the moment. They don't have any other time frame, right? They're loving life, right? They're out there today, probably rolling in the snow. And, you know, there's really nothing else that they're thinking about they have to do. But we're trained out of that natural state of connection with the present moment, connection with the earth by, you know, learning that we need to plan for the future and worry about this and that. And so we train our brains into, you know, focusing on these other things. And so it's only natural that that's what your mind wants to do. And I often think of it as, well, it's a retraining and it's a skill we need to learn, you know, and it's useful to think of it like something like playing piano, right? Or playing tennis, a sport of some kind, you know. So you can read all you want about piano, you can listen to music, you can really try, you know, want to be a piano player, but unless you're actually sitting down every day practicing on the keys, you'll never become a virtuoso, right? And so you can want to be mindful and pay attention in the present moment, but we don't have necessarily the capacity or the skill unless we train our minds to do it. And so I think of that training, you know, and actually there's all sorts of neuroscience where they scan people's brains and they look at connections in different parts of the brain. And, you know, a kind of anxious or sad brain has a certain pattern. And it's almost like, I think of it like a field, you know, of grass, and how people take a shortcut across the field and they wear these paths in the grass, right? And so the well-worn paths, that's how our minds have learned to operate through so many years. And often those paths support anxiety or depression or worry. Those are the neural connections that we so often tread. So the mindfulness training, even something as simple as directing your attention to the breath over and over again, it actually starts a new path. Like, it rewires the neurons in your brain in a path that supports the ability to be mindful, and is also associated with neural or brain patterns that are conducive to happy moods, right? So you're actually rewiring your brain when you do this. And studies have shown that even 2 months of training changes the patterns and the function, the connectivity in your brain. And it's that training, that skill building that does it.
Wow. And for someone who's just starting, wanting to bring mindfulness into their daily routine, how often, like what's the kind of beginner schedule that you might, look at me, I don't think scheduling is the right word. Now I'm getting stressed.
Well, it kind of is actually.
Schedule.
Well, it kind of is, because at the beginning it can be a bit of a chore, right? It's not always, you know, and so I guess I should address some of the myths too of mindfulness that often turn people off, right? Because there's a belief that, you know, and I often show a slide of Time magazine covers, and it shows these beautiful young blonde women looking all blissful, and it says mindfulness, and you're like, you know, they're floating on a cloud or something. And so that's a misconception, that people think their minds should be blank, they should feel wonderful, you know, they should be all blissed out. But it's not like that often at the beginning, because mindfulness is just about paying attention to whatever is there. And often what's there is chaos, right? Or worry or anxiety. And so we can be mindful, we can hold all of that, but it's not often what people are expecting, right? This sort of jumbled, jumpy mind. And so I really need to understand that that may be the experience for the first few weeks, say you're practicing, you know, and even longer term now, and then it's going to be like that, right? And so with the training, that's what we really emphasize to people is that, you know, and I make the joke, oh, this stress reduction is very stressful, right? Because I'm asking you, to schedule extra time, right? And so you actually do need to find time in your schedule for it, to make it a priority, and to do it every day, even if it's not enjoyable always, right? It's like, why am I setting aside time and trying so hard to do something that's not fun, right? But I've been teaching these programs for 22 years now and had thousands of people through, and I see it every time, is that if people can persist and have that attitude of just kindness and compassion and, oh, this is a struggle, this, you know, my mind is crazy, right? And that's okay. It's all okay. It's part of the process. After a few weeks of regular practice, and you asked how much, you know, 20 to 30 minutes a day, 10 minutes, if that's what you can do, a regular practice is useful, right? Every day, making it part of your life, and also applying those attitudes towards not only your mindfulness practice, but other elements of your life. This sort of slowing down, a bit of a more patience, you know, We have this fast food society. I want to relax. I want to relax right now. Got to have it now, right? Mindfulness now, McMindfulness. And it's just not that way. We have to cultivate patience. We have to work at non-attachment to outcome and non-striving. There's all these sorts of attitudes that go along with the practice that are transformational.
Great, thank you. I'm just looking at some of the questions, and Deepu is asking, how does mindfulness compare to meditative practices?
So mindfulness is a form of meditation.
Okay.
And so I talked about two different sort of elements to mindfulness. So one is just your everyday mindfulness. So it's just your awareness every day. So that's a bit different than meditation. That's just your state of being. So you can be aware and mindful, or you can be distracted. But mindfulness meditation is a meditation practice. So that's where we do the formal practice. We set aside the 20 minutes every day, and the practice may be mindfulness of breath, like we were doing, right? Just paying attention to your breathing is a way to retrain the mind. There's many other forms of meditation that also strengthen your capacity to be mindfulness. So be mindful. So we will do things like a body scan, which is a meditation where you pay attention, slowly moving through the body to all the different body parts. You can also do an open awareness meditation where it's not just focus on the breath or the body, but opening to whatever arises in your experience. And so those are akin to other forms of meditation as well that people might know of. For example, often, older people during the 60s did TM, or transcendental meditation. And that's a very similar practice. Instead of focusing on the breath, you're repeating a phrase or a word that has some kind of meaning, called a mantra. But it's the same kind of focus, right? It's training our capacity for sustained attention.
You mentioned, when you were talking about the body scans and some of those different practices for meditation, talking about some of the emotions that come to the surface. And I know in your book, you talk a little bit about the mindfulness practice can bring at least space for feelings and for emotions. How do you suggest, when you're talking in your clinic with your patients, that they manage those emotions?
Yeah, well, first of all, not to get worried about it, not add in extra anxiety. The mindfulness practice is a place where people have more say or more control about how they expose themselves to these difficult emotions, right? So sometimes people are afraid that if they allow themselves to feel what they're feeling, that it's going to be out of control, right? That they'll never stop crying and that kind of thing. So then they just sort of suppress it. They say, I can't deal with this now, it's too much, right? So the mindfulness practice is a time where you can purposefully kind of open the doors, and allow those emotions to just spontaneously arise. Because if they're there, they will show up when you sit down quietly and try not to focus on a million other things, right? If you just focus on what's in the moment, that's often the experience people have, is that these emotions they've been avoiding and trying not to deal with will kind of well up. And that's a good thing, right? Because emotions are healthy. What's unhealthy is suppressing emotions, pretending they don't exist, thinking you have to put on a happy face all the time. That's exhausting, right? So letting go of the facade and just saying, it's okay to feel rotten. It's okay to be scared. It's okay to be sad. There's grief in this process. And the mindfulness practice is a really wonderful container where you can allow yourself to just work through and process those different emotions, because they will shift and change, but only if we give them the space to move, right?
Sorry, I was muted. And I think you answered in some of the pre-questions that our participants sent today. A lot of them were exactly what you touched on. How do I manage, putting that facade out front, saying everything's okay to my family and friends, when really inside it isn't, and letting go of that, allowing those emotions and that stress. And
often we believe that it's kind of our job to manage the emotions of the people in our lives, our family and our friends. And it's not your job to do that, right? It's your job to manage how you respond to their distress. It's not your job to fix their distress, right? So if their suffering is causing you suffering, well, you can work on that, on your own response to that, right? but really it's up to them, and certainly referring them to sources of support, to counselors. Support people need help as well. We know that, right? It's a different thing than being the patient, but all the focus is on the patient. And then the support person often feels, they have to sort of just hold it all together. So in our program, we have both patients and support people. They come together, and that's often the best combination because they can work through the practices together.
So mindfulness is going to help everybody.
Absolutely.
We had another question. I think you've touched a lot around the stress. Someone was asking, how does mindfulness reduce pain? Is there any research or studies around pain reduction in mindfulness?
Absolutely. And you know what? I'm going to take a step back and talk a bit more about the stress response, and then I'll get into pain. So I talked about more the way we think about, cognitively about the things that cause us stress, but there's the whole physiological piece that the mindfulness training works on too. So when we perceive something as threatening or overwhelming, we have that stress response. And it's called the fight or flight reactivity. It's governed by our nervous system. And it's, for example, you're driving your car and, a dog rushes in front of you, you almost hit it, you jump, your heart starts racing, your palms are sweaty, right? Your blood pressure goes up, your muscles are tense. That's that fight or flight. And we often get that throughout the day, even when the stressors are things we can't, fight or run away from, right? You can't always punch your boss in the nose or run out of the cancer center. You got to get to treatment, right? And so we have this mounting stress response, yet we don't find a way to kind of discharge it. So normally, you run away and the danger, the threat is gone, and you sort of, your arousal level, lowers down. And so the mindfulness practice can be a way to actually decrease that level of stress, that level of kind of excitement or arousal from the stress response, just sort of bring down your baseline, your physiology. So what happens when you do the mindfulness practice, and even earlier when we were just focusing on the breath, is that it triggers part of the nervous system that's responsible for the relaxation response. So the opposite of the stress response. So as we breathe more deeply, it stimulates relaxation and our heart rate goes down, your blood pressure goes down, the muscles relax. In fact, your digestion improves, you can focus better. It helps people sleep because it's taking the level that you're operating at from up here, you're vibrating at this level, and it doesn't take much to trigger you off, right? You're losing it for yelling at your kids or crying just for, the smallest things. Sort of brings your baseline level way down here, so you have so much more capacity to respond to the challenges in life. So that just the physiology of it helps you cope better with stress. So the next is pain.
And then, yes.
Yeah. So the way we think about pain is that there's a little equation. It's actually pain equals suffering. So the total amount of suffering that we experience from pain. So suffering, S equals pain times resistance. So R is our resistance to the pain. So the pain in and of itself is one thing, but what magnifies our suffering is the fact that we hate the pain and we don't want it to be there, and we tense around it and we wish it away, and we gloom about how can I spend the rest of my life with this kind of pain. And so it's the resistance, mental and physical, that we have towards the pain that increases our amount of suffering. So in the mindfulness practice, when pain arises, in a knee or a hip or wherever it is, what we do is actually turn our attention towards the pain and deconstruct the sensation to a certain extent, as well as try and release and relax the muscle tension around it. Because when we tense around an area of pain, it actually makes it worse. So we try and release around pain, and then we explore it, the nuance of it. Are there spaces in between the pain? Is it constant pain? Are there areas in the body that don't feel pain? And so instead of turning away from the pain, we turn towards it and embrace it again with kindness and compassion, and learn to understand it a little bit better. And so the pain itself may not go away, but the suffering we experience can be much less.
That sounds almost similar to what you were saying earlier about letting those emotions,
Yes.
resisting those negative emotions, or those, I shouldn't say negative, but resisting the emotions that we might have labeled as negative.
Yeah, the difficult ones, right?
Yeah.
That Exactly. Yeah. And it really, so the opposite of resistance is acceptance. And one of the key attitudes around mindfulness practice is acceptance. And this can be a tricky one for people with cancer, because we're not saying you accept the illness or accept a poor outcome or anything like that. It's not about giving up or giving in. It's about seeing clearly what is. It's letting go of the resistance and denial. It's embracing the moment, knowing the flip side of acceptance is non-attachment or constant change, right? So it's recognizing that life is, the only certainty in life is change. And so even if our situation or our experience in the moment, seems awful, we know that it's going to be changing in many different ways over time. And so it's like this idea of the ocean, right? There's the ocean, a huge body of it, swelling, rising and falling. There's also these waves, individual waves that come and go, and so it's about kind of learning to ride the waves, right? Learning to surf. You can't stop the ocean. The ocean is in constant flux. The waves are coming and going, and those are kind of like the thoughts and your experience, right? And so instead of trying to, fight the ocean, which is a losing battle, it's more like learning to surf, right? Riding the waves. And so you're letting go of that struggle, that resistance that causes so much, well, it's exhausting and causes a lot of suffering.
Great. I want to just jump to the questions. There's one that we got earlier, as well as I see something here that's similar. How does exercise and mindfulness, what is that connection? Whether it's yoga or walking, or how does exercise fit in?
Sure. Well, we can do anything mindfully. So you can exercise in a mindful way. And I often do that. I'm a runner, not a, long distance runner, but when I go running, instead of, mulling over things, I'll really be in the body and be thinking, in, out, as I'm breathing, or step, 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 step. And so you can do that experience in a mindful way. The other thing about it, you mentioned yoga. And so the program we do, the mindfulness-based stress reduction or cancer recovery kind of standard programs, utilize yoga as a moving meditation. And so it really is a great practice. And half of what we do, is the mindful movement or the yoga in a very gentle way. So it's not like a competitive kind of, strenuous yoga, where you're trying to wrap your leg around your head and so you can bend the furthest, right? It's very slow moving. It's paying attention in a mindful way. And it's really about connecting with the body, because, our mind and body are not separate. Every state of mind is a state of body. And sometimes we're so disconnected from our physical bodies. There's a quote we like to use. It was, I think, James Joyce, but it goes, Mr. Quinn lived a short distance from his body. Right? And so when you've gone through the experience of cancer, there's even more of that disconnection, or there can be, and there can be hard feelings, right? You can be mad at your body or feel betrayed or think, what did I do to deserve this? I've treated my body pretty well through my life, and here it's giving me this disease. And there's changes also from the treatments, from the surgeries, from the medications and the chemo. And so it's really an opportunity to reconnect with the body and refriend the body, and realize that, as long as you're here, you're breathing and moving, there's more going right than there is going wrong. And so it's really about getting to know the body again as it is, with kindness. Your body may not be up to what it was before. That's okay, right? It is kind of what it is, and it's serving you as well as it can. And so that movement practice helps, I think, people in a number of different ways.
Well, and I think, one of the things, obviously, for Look Good, Feel Better is we offer workshops to help manage the appearance-related impacts of cancer treatment, whether it's hair loss, changes to the skin. But there are so many changes that might happen to the body that it is around acceptance as well, and that it might be temporary, to your point about change in the ocean. And
yeah, and recognizing that in the grand scheme of things, at the end, we're so much more than these bodies, and people often identify with different elements of themselves, from the most superficial, your possessions, your house, your roles, your job, your profession, kind of your roles as a mother, daughter, spouse, and, even your ideas and your values. But at the root of it, what is essential about us as human beings? And that's, not a question I'm going to answer for you, but there is an essence, this bare sort of field of awareness that's beyond all those things. You know, it's not dependent on all those things, our sense of self and being in connectedness. You know, I like to think of the metaphor of the sky, right? The blue sky. And so sometimes it's obstructed by clouds, big, heavy gray clouds or little fluffy clouds. And they, you know, sometimes we can forget about the sky that's beyond the clouds when we can't see it, right? And our experience is like that too. Sometimes it seems our lives are just coming at us with these low clouds, but really our essence is the blue sky, right? All of us. And that's vast and endless and interconnected. And it's always there to tap into that sort of field of awareness. So that's a bit esoteric. It may not make sense to everyone. But it is something that the mindfulness practice gets you in touch with.
Great. I think maybe we should try another exercise. Can we do that?
Sure.
Just in case. Yeah. Which one do you think?
I think I'll give you a couple of mini breathing exercises because these are things that are really practical and can be used in any sort of circumstance where you're starting to feel anxious or stressed. So, you know, if you're waiting for a treatment, or even if you're getting an infusion, or, you know, having an argument with someone, or, you know, feeling anxious. So they're really short breathing exercises. They're called the minis. And all of them start by allowing ourselves to just sort of release and turn to a deeper kind of breathing pattern. So we'll do that first. So you can just put your hand on your belly this time. And I want you to just soften in the belly. So you can close your eyes if you want. So often, again, we're taught to hold in our bellies and, you know, have this sort of tenseness, but let's just begin by just letting it all out and letting it just become relaxed and soft in the belly, and then just allow the breath to flow. So don't try and force it, just allow it to sort of come and go on its own. And then as you breathe in, imagine just lengthening that a little bit. Maybe you can count up to 4. Without forcing it, you might feel your belly rise a little bit. And then as you exhale, you can also count to 4. So we just want to switch to that slow sort of breathing pattern, and that taps into that relaxation response I mentioned. It helps you access that. And now as you're breathing, we're going to just count these breaths. And this one we call the staircase. So imagine with each breath. So as you breathe in and out, we're going to count down from 10 to 0. And imagine with each step, it's like you're going down a step. So you could picture a staircase. So 10 in, out, 9 in, out, 8 in, out, and just go at your own pace until you get down to the bottom of the staircase and you're at 0. So don't force it, just go at your own pace. And you can even imagine as you go down each step, just sinking a little bit into relaxation, your shoulders dropping, letting go of the tension. So you're down at 0, Sue? You're at 0. So that's one of them that you can do. I usually ask how people feel after doing that. You can jot a few things in the chat if you want.
Hopefully everyone's still awake.
I hope so. While you're doing that, I'll introduce another one. So this one is similar, relax, someone said. This is similar and it uses a visualization, and it's like a wave. I call this one the wave. It's pretty straightforward. And as we breathe in with this one, as we go up the wave, we count up 1, 2, 3, 4, and try and make it really smooth at the top, and then count down 4, 3, 2, 1. And then up 1, 2, 3, 4, and down 4, 3, 2, 1. We'll just do this for a few more breaths. You can follow the wave, or if you like, you can turn it into like a figure 8. Okay, let's open your eyes and come back. I just saw a really interesting question pop up about stress and cancer. And I think that's to address.
Yeah.
The relationship between both, does stress cause cancer, and does stress management have an effect on cancer outcomes, are important. And the first thing to recognize is that what causes cancer is very complex. Okay, the cancer biologists don't even know. There's hundreds of different kinds of cancers. What we do know is that stress may be one of the contributing factors, and it's going to be different for each individual and each type of cancer and all that kind of stuff. And so it may play a role because stress can have some physiological effects on our immune system and different systems within the body. So we will never know for any individual how much of a role stress may have played in leading up to risk for cancer. So that's kind of an open question. The research is mixed on that. What we do know, though, is that when people learn to manage stress, and especially manage emotions like depression, they may have better cancer outcomes. So we do see that people who are depressed when they get cancer, that if they're able to kind of manage their depression over time, they may do better in the long run. Again, it's not a definitive answer. And I think for me, what's most important is not necessarily the effect it might have on the quantity of life, but on the quality of life. So no matter how long a person's going to live, if you can live better and you can feel better and be happier for whatever days you have, I think that's worth a lot. So I don't know if that addresses that adequately, but happy to have follow-up questions.
And if you think about those outcomes with managing stress and the quality of life, and we were talking earlier about the stages of stress when one is dealing with cancer, both during diagnosis and treatment, and also later when you've got your annual checkup to check out how everything is doing, and that wave of stress.
That kind of comes up every year with the checkup, right? So that fear of cancer recurrence is super common, no matter how good your prognosis. And so the way we tend to work with that is, again, to just recognize it when it's starting to build, that anxiety. And what actually tends to happen is you can get in a negative spiral where maybe you have a symptom that was something you had when you first got diagnosed with cancer, right? Maybe it's some, tightness in the chest or whatever it is, right? And you're like, oh no, that's the symptom I had. It must mean my cancer's back, right? And then you're very vigilant and you're stressed and you keep monitoring it. Maybe you're poking yourself. And so you get really wound up, and that tends to make the symptom worse. It's kind of like the pain, right? And then you think, oh my God, it's worse. Definitely the cancer's back, right? So you get in this sort of negative spiral. And so the one way to avoid that is to just notice, again, when you have the symptom, say, okay, well, this may or may not be related to cancer. So I'm not going to worry about it right now. I'll just use what I know how to relax, do a few deep breaths. And if this persists, for say a couple of weeks or whatever time frame you set for yourself, then I'll go to the doctor, right? So you recognize it, you set it aside, you do the kind of relaxation things, and often it'll just pass. But if it does persist, then you've got a plan that you're going to get it looked into.
That's a really interesting, I love that comment, that idea of, at the beginning when you were talking about, this worry for the future and about being in the present. It doesn't mean we're not planning for the future. It just means once we make our plan, we've got it, and let's stay in the present. And
there's a difference between planning and just worrying, right? Worrying doesn't help us plan for the future. It just is like this futile, it's like a hamster in a wheel, right? You're just going over the same stuff again, again. So there's also, I guess, this misconception that if you're practicing meditation, you turn to this lump who just doesn't care and never gets anything done. And, that's not it at all, right? Like, we take time to plan for the future, but we do it mindfully, right? We do it on purpose and say, okay, now I'm going to even write down my worry list, right? And then I'm going to set it aside, and now I'm going to make the plans for all the eventualities, maybe I'll write them down, but then you just set it aside until you need it.
Right. There's a couple questions popping up, and a lot of them are around resources and when can I do this and how often should I do it? And I know you had recommended a few apps and different websites for us. So I want to let everyone know Diana's going to plug them into the chat box, but I wanted to, but as we go, did you want to just talk about some of the resources out there that you like?
Okay, I'm just looking at some of the questions. So these days, most of the mindfulness programs are online, which is kind of good no matter where you live. So generic mindfulness programs are offered through the Center, oh, what's it called now in Toronto? The Center for Mindfulness Studies out of Toronto. And they have a lot of online programs, which are general training in what we call MBSR, which is the model we use, mindfulness-based stress reduction. So those are good general programs. A lot of cancer centers have cancer-specific programs. So I would suggest asking, usually it's through the supportive care or the psychosocial department at the cancer center. So that's where ours in Calgary is offered through. So those may also be available. Then there are also online programs. For example, there's a company called emindful.com. And hopefully get that one in the chat.
Yeah, it's there.
I actually wrote a program for them based on our mindfulness-based cancer recovery. And so they offer that commercially now, kind of, I think, ongoing. And so that's something you pay a bit for, but it's available in, I think it's 12 55-minute sessions. And then there's a gazillion apps out there. So if you're someone who likes to use apps, the kinds that, there's many that people like. One that's simple is called Insight Timer, and that has guided meditations and just timers. It's not really a training program in mindfulness though. So if you want to get our actual program, the app version is called the Mindfulness-Based Cancer Survivorship Journey. And it's within an app called Mindfulness. So that's a mouthful. But if you look for the app Mindfulness, it's out of Toronto. It's actually really a very good general mindfulness training app. It has these journey programs, which are a combination of guided meditations plus teachings, kind of what I've been talking about. And so the MBCS journey one is actually myself and Michael Specka, who I taught with for 20 years. He just retired. So it's the two of us just talking, interspersed with different guided meditations. So it's a good way to sort of do the program if you can't, come and do the program. And then there's the book too that you already mentioned. So that's designed as a self-study guide as well. And other apps that are popular, Headspace is a popular one, Calm, there's one called 10% Happier. Those are more generic. Oh yeah, someone else just put 10% happier. Yeah.
Yeah, perfect. So we can bring you home, because I was just thinking, how am I going to get this done without your voice leading me through that?
Yeah, so my voice is the MBCS journey on the Mindfulness app. And Michael, he's much more soothing than me. I'm the high energy one. He's the Buddha.
Perfect. So we just have about 5 more minutes. So
oh yeah, Palouse Mindfulness. That's another good one someone mentioned. Yeah.
Oh, perfect. So I'm just going to quickly go through some of these questions and let's see what we've got in here to see if there's anything. We've got someone asking about the best breathing practice for insomnia. Would some of those minis that we just did help with that?
We actually have an insomnia breathing practice in the MBCR book. It's a little bit more complicated because it takes into account some other principles, but essentially you switch to, so there's a breathing pattern called 2-to-1 breath, where you breathe in for 4 and out for 8. So it emphasizes the out breath, which is the relaxing part of the breath. So it helps to sleep if you kind of want to emphasize the out breath. And so you breathe in for 4, out for 8. And then you can do that on your back and then on one side and then on the other side and sort of count up the breaths. And that keeps your mind busy and it physiologically prepares you for sleeping. So that's the short version of it, but it's actually described in our book too.
We won't do it now or else we'll all be asleep and we won't be able to actually do this. How often, Linda, do you practice mindfulness? What's your schedule if you've got one?
It's shifted a lot over the years, I have to say. Like I've been practicing for about 25 years. And so when I was a young student and had no family or anything like that, it was very easy to practice every day. And I did half an hour a day, and then I went up to 45 minutes a day. And I was very, very conscientious about it and regular with the practice. But I find that having a family and, these other responsibilities has made it a lot more challenging. So I would say now I also practice a lot of what we call informal mindfulness. So that's things like doing the minis in the moment, kind of using the practices as I go through my life a lot. And then I'll do formal practice maybe 2 or 3 times a week. So I'd like to do it every day. And I do advise that for people, but there's also reality that comes into it.
And I would imagine, when I think about all the fitness articles I've read where they talk about this much of exercise a day, this, and this, and at the end of the day, it's whatever exercise you do is going to be beneficial and whatever you can fit in. Is it the same idea with mindfulness.
Absolutely. Yeah. You know, and at the beginning, when we're just getting used to it, it does help to have that regular practice and make a commitment, you know, before it becomes kind of a habit. Right. And, you know, we actually often use the term mental floss. Right. So there's dental floss for your dental hygiene. You do it every day, or a lot of people do, you know, you do it regularly. It's like mental floss, right? It's like putting money in the bank. Right. It's kind of setting yourself up. It's like exercise. It's like getting, you know, a base level of fitness. Right. So it's like mental fitness. It's sort of, you know, getting to a point where you feel like you can respond better to the stressors in your life, and, you know, things are just a little smoother. And then you got to keep topping up the bank by doing the practice. Right.
That's great. Oh, someone's asking, we were using an acronym here, MBCR, if you want to.
Oh, yes. So a lot of these programs, and I should give a plug for John Kabat-Zinn, who's a wonderful guy who started this type of mindfulness training program back in the 1970s in Massachusetts Medical Center. And he has a wonderful book called Full Catastrophe Living. Recommend it to everybody. But he called it mindfulness-based stress reduction. So that's MBSR. And you may see that acronym quite a bit, because there's many, many MBSR programs and many people trained to deliver it. So that's a standard 8-week training program, you know, a couple hours a week, where it sort of just takes you through what I've been talking about. So our adaptation of that is called mindfulness-based cancer recovery. So MBCR, that's what that stands for. That's
great. And I'm just checking, there was a question that came in ahead of time and someone else has popped it in here. And I see we're gonna, Diana, if we could put Dr. Carlson's book in the chat, a couple people are asking for that as well. How do you, and you've got 2 young kids yourself, how do you, a lot of people know that it's helpful for children, and, you know, if
there's a
parent going through cancer. Do you want to talk about that for a couple minutes?
Yeah. Oh, sorry. Did you say kids with cancer? I was going to say kids.
Well, no, or kids, but, you know, they might be managing, you know, their parent or, you know.
Oh, absolutely. Yeah. You know, there is a huge influx of interest in mindfulness in education, and mindfulness in the schools, and mindfulness for teachers. You know, and we also know that it's good for kids coping with all these changes in the family when one of their parents has been diagnosed as well. Yeah. So there's many resources for that too. There's like, if you just start searching the web for like kids meditations, you'll find things. And the kids, you know, they're more concrete. So they're shorter meditations. They're a little bit more fun, but there's many of them out there.
Oh, I can't believe we're already at the top of the hour.
That was fast.
It was really fast. Thank you so much for sharing. I think you know, if I think about some of those takeaways, it's that, you know, you can schedule as much time as you can into this, that there's so many great resources out there, that at the end of the day, it's going to have that stress relief that's going to help you in the moment and manage through your journey, but also know that there's long-term benefits and physical benefits that happen as well. I think we could have probably done 3 hours, and maybe every night you could come in and just help us all relax as we go to sleep. So,
well, I just thought of a whole bunch of other stuff I didn't mention, but.
Okay, we're going to have you back then. Everyone stay tuned. We're going to do another
well, thank you for inviting me.
So I just want to remind everyone, please do go to lgfb.ca. You can sign up for our newsletter, and then you'll be informed of our next speaker series that we have coming up. Just a reminder that we've got 3 workshops online for women and teens facing cancer around dealing with skincare and cosmetics, hair loss, as well as breast forms and garments. And so if you want to get some practical tips and techniques from our amazing volunteers, please do join us. And and there's a special one for teenagers as well. We'll be sending out an email at the end, and we'll have all the links to the resources that Dr. Carlson mentioned, as well as a survey. So please do take a minute to fill it out. Let us know how you found this session, topics you'd love to hear for the next session. Maybe everyone's going to say, have Dr. Carlson come back. Again, thank you to the Globe and Mail for sponsoring this evening. And Linda, a huge thank you for giving up an hour of your time to share all this amazing information with everybody. We just appreciate it so much.
Well, I'm always happy to have an interested and attentive audience. So thank you so much for inviting me.
Thank you. Thank you, everyone. Merci beaucoup.